during prenatal care, you have approximately 8 to 9 visits,
Mhm.
right? So that's a lot of doctor's appointments.
Surely.
You deliver your baby, you go home, you think, I have a healthy baby and I'm doing okay.
Yeah.
And then you kind of think, do I really need to go back for my postpartum care? And often you suffer in silence.
Mhm.
And something I don't often share is that, as a practicing OB-GYN, after my first child, I had postpartum depression. Didn't realize I had postpartum depression um, because for the most part, everybody thought I was okay.
Yeah.
But I think had someone said to me, "Are you okay?"
Yeah.
I would have discovered that a lot earlier. And one day I just woke up and it was like a curtain that opened up.
Mhm.
And I was like, wow, the last 9 months, a year have not been normal.
Wow.
Um, but no one really asked me, how are you doing mentally?
Mhm.
How's your mental health? So I think we just get into survival mode. We've
Yeah.
got a baby, we might have other children at home. If we're not bleeding to death or in so much pain we can't go on, we just kind of ignore everything until it comes to a head. And by that time it's often too late. When I did my training and earlier in my career, we made assumptions.
Sure.
But now at every single visit we're asking, you know, do you have feelings of sadness?
Mhm.
Any thoughts of suicide? Are you eating? Do you have, sufficient food? We ask all of those questions that get to um, everyday life. And so we're less likely to miss those things. So it's at least now we're asking the questions,
Okay.
but we have to just educate our patients that we really do want to know the
Right.
answers.
And what are the risks of skipping those postpartum visits?
Perhaps sometimes we think that our bleeding is normal or that our pain is normal or that, the fact that we have, you know, not returned to having regular menstrual cycle, all those things that we may think or perceive to be normal
Yeah.
could be addressed in a postpartum visit.